welcome to our virtual town hall for Fort Gordon. This is our third town hall that deals with COVID-19, the COVID-19 subject matter, and the intent of this is to ensure you have the most up-to-date information about the commands and the installation's response to the COVID-19 pandemic. The response to the COVID-19 health crisis involves a whole of government approach and is being led within the Department of Defense by the Secretary of Defense and the Chairman of the Joint Chiefs of Staff. COVID-19 remains to be a fluid situation, and I know that soldiers, their families, and our civilian employees have questions and concerns. We will get to many of these today during the question and answer session, but as always, I encourage everyone to utilize your chain of command and supervisors for any issues you might have. We will all get through this health emergency together. It is not a question of if we will, it's when we'll get through this. Here on Fort Gordon, the Installation Operations Center is operating around the clock to ensure the safety and well-being of everyone on post. To ensure we protect the force, the limits of travel have changed from 4 hours to now within 100 miles of Fort Gordon. So I'll close with two thoughts for you. First, we are in this fight to prevent the spread of the virus together. This will be a marathon, it won't be a sprint. So prepare yourselves and your families for the long-term temporary new normal. We have plans and routines in place that are sustainable over the long haul so that we can successfully weather this storm. And then second, stay positive. Keep communicating early and often. And let's all focus on banding together to be part of the solution during these challenging times. I have my battle buddy with me, Command Sergeant Major Quintero. She's going to say some things after we get through the question and answer session. But without any further ado, I'm going to turn it over to our command teams to cover some subjects.
Good morning, everyone. I am Lieutenant Colonel Wendy Miklos, Chief of Public Health here at Fort Gordon. I want to talk a little bit about epidemiology this morning. We know that globally there's over 480,000 cases, and in the United States there are over 68,000 cases. In Georgia, we now have over 1,200 cases, and these numbers get updated at noon daily. So we know that there are multiple epicenters now. Most of these are major metropolitan areas. Leading that is New York. Behind that is Seattle, and again, most major cities. Here in Georgia, we know that we have most of our cases around the urban areas of Atlanta and Albany, but also in South Carolina around the city of Columbia. We have a few cases in our surrounding counties, but so far those have remained at a low number and manageable by our medical facilities. So when it comes to protecting ourselves, we know that there's about a 1 to 1.5% death rate, and that's typically among elderly individuals and those with underlying comorbidities. They are also finding that smoking is a huge risk factor. In other countries where they had high numbers of individuals who smoked, such as older Chinese males, those individuals suffered a much higher fatality rate. Now would be a perfect opportunity to discontinue smoking. If you have a loved one that is still working and coming home, and you're worried that they might be bringing something home, you can take additional measures beyond the regular preventive measures that have been recommended, such as hand washing. Some of those measures include just general routine cleaning with household cleaners according to the manufacturer's directions, or using a bleach and water mix. The bleach water mix should be 5 tablespoons or 1/3 cup per gallon of water, or 4 teaspoons per quart of water. And that's recommended at least daily or more often as needed. You can also set up a separate room, preferably with a separate bathroom for that individual, Some people are also setting up RVs for matters where they're having someone who's working in the situation may be risky, or if they're having someone come in from out of the area. It's also recommended to avoid sharing household and personal items with these concerning individuals, such as utensils. You should also launder items and have fresh uniforms or scrubs or clothing on a daily basis, or more often as needed. I will be followed by the hospital commander, Colonel Blanding. Thank you.
Good morning. So what is the role of the healthcare provider during times of crisis? As you've heard the epidemiology piece of this, what is important is that the role of the healthcare provider does not change. It's the voice of calm and it's the voice of reason. We're here to ensure the safety of the public community that we serve. Our healthcare providers understand their role, they understand their mission, and they're fully engaged in ensuring both their safety and our safety. So the question has been asked, what protective measures are being taken to ensure that the staff remains safe? We have done a great job. We have our personal protective equipment. We've had some questions regarding that. We have ample amount of equipment to ensure that our staff remains safe. We have limited entrances within our facilities. So we have a screening process that is currently in place. Staff are required to enter the hospital through the 4th floor entrances. And we've allowed a couple of other additional entrances based on the volume of staff members that come in. We also have screening processes for our members that are coming into the facility. Okay? We've done social distancing for internal to the Eisenhower. We've eliminated close contact when it comes to our meetings. We're doing TCONs, we're doing virtual meetings. We're allowing no more than 10 in a room, and we're doing the spacing with chairs in between just to ensure the safety of our staff. We have increased our cleaning measures. Like any healthcare facilities, our concern is to always be careful, and we have updated and upgraded our cleaning between patients in our pharmacy, as that tends to be a high volume area. We've increased our cleaning capacities there also. And I've talked about the personal protective measures, okay? We've restricted movement, and we're allowing staff to work. We have opened up the opportunity for our staff to utilize some of the human resources options that are available, such as telework, admin leave, and as admission dictates, okay? For you, the patient, your concerns having to do with what protective measures are we taking, okay? We've established, if you've been to Eisenhower within the last week, we've established what is called the influenza-like illness clinic. And what this does is eliminate the traffic flow within our emergency room and allows us to see patients in our tent city that we have established. Next week, we will go full up with the actual full tentage that we'll have complete capabilities to not just screen, but to be able to test in the facilities outside of the structure, okay? We have traffic pattern that has been established, and you will see the cones along the way and the barriers that are set up. I do ask you that as you're coming into Eisenhower, that you please adhere to the traffic signals we have, the barriers that we've put in place. And I do ask you as patients coming into the facility, as you're going through the screening process, that you please take a moment, this is for your safety, to engage in the screening process and tell us the truth if you're having signs and symptoms, so that we can appropriately triage you and have you go into the right area, okay? Inside the hospital, on our website, you should see, I think we've already posted it, a listing of the decrease in services that we're providing. We have consolidated some services. We have tried as much as possible to eliminate face-to-face services to ensure that both your safety and the safety of our staff is of utmost importance. And we have increased hygiene within our facilities. Everyone understands, as we're engaging in this crisis, the need for us to be for personal accountability as well as organizational accountability. And so we have established across our organization when it comes to personal hygiene, for sanitation, for extra cleaning when it comes to our equipment, and of course enforcing social distancing. One of the key things for us has to do with the PX pharmacy. If you've been there lately, the PX pharmacy, we've closed the waiting area. We're now doing a curbside activity where the soldiers will come in through a screening process. We'll take your card, and the soldiers will go and get your medication for you. The process has really been streamlined. I've heard positive things both from U.S. patients and from the Eisenhower team that this is going well. And so we thank you for supporting us in that endeavor. And so I think I needed to address the question about the PX pharmacy. These are the new operating hours for the PX pharmacies, Monday through Fridays from 09 to 1700. Okay? And for the PX pharmacy also, again, as I talked about, it's remaining in your vehicles at all times, and it's ensuring that you're following the traffic signs that are established, and more importantly, that you're understanding that the PX pharmacy is only for refills. We have changed that process. And so if you have a new prescription, you will need to come to the main building, and the main building will be set up in a tent so that we're able to afford you the opportunity again for screening processes and to ensure both your safety and the safety of our staff. As the Eisenhower commander, I want to assure you that your safety and the safety of the Eisenhower team is of utmost importance to me, and that we have engaged in all deliberate activities to ensure that we maintain that. Thank you. I will be followed by the garrison commander.
Morning, I'm Jim Clifford. I'm your garrison commander here at Fort Gordon. So let's talk about some of the services that we are changing here since the last town hall update and give you an update of where we're at. So the first thing we're going to cover really is the CYS facilities, which most of you know is the child daycare centers. So we have a number of facilities here on the installation. We operate 3 child daycare centers, east, west, and main. We also have a school age center and a middle school and teen center. So let me give you a quick update of where we are on all those facilities and where we see this all going. So the middle school and teen center we closed last week based on lack of patronage. So at one point in time, we got down to one middle schooler that was showing up, and so we ended up closing that facility based on lack of patronage. We're going to keep that facility in reserve, if you will, for potential use for soldiers or contingency operations because it's a usable facility for us here on the installation. So for the rest of the coronavirus response, we're not looking to reopen the middle school and teen center. We've closed CDC West. We're going to end up using that as our tactical reserve for CDCs. So we have a level 2 clean facility now. That all of the facilities were cleaned to a level 2 on Monday when we did our stand down. So the CDC West we're going to leave in a standby status so we can transfer children over there if it's required. So what that really leaves us with now is you have CDC East, CDC Main, and the school age center. For those facilities, the primary users that we're looking at is Colonel Blanding's team over at DDMAC. They are the priority users for that facility, so we can enable our healthcare workers to provide the world-class care that they do here at DDMAC. The second tranche is for our first responders. So that's our police, our fire, our EMS personnel, along with our gate guards and security personnel that are allowing us to have gate access throughout the crisis that we're dealing with. And then the next level down, the next tranche, if you will, is supporting Colonel Batson and the 15th Signal Brigade for drill sergeants and drill instructors, because we're still getting AIT trainees, and we still have to manage those trainee populations with drill sergeants and instructors as we go forward. After that, the priorities start to fall off. And so those are the areas that we're really looking at the most, and those are the folks that have the ability to bring their children into a CDC at this point in time. We do a daily scrub of who is coming into our facilities, and we do that as an operation with the commanders to make sure that we have the right people that have their children in childcare so they can maintain capability on the installation. So that covers largely our child development centers, and I'm sure we'll get some questions about that in the Q&A. We're also providing some activities here through DFMWR, which also operates the CDCs, to allow social distancing. So we've closed a number of DFMWR activities, but we are allowing golf, we're allowing disc golf, we're allowing those types of activities where you can have some standoff from your fellow man and be able to do social distance as required. for the restaurants that our MWR operates, all those restaurants, along with any restaurant on post, is carry out or drive-through only. So there is no in-seating dining areas. In our areas here at the MWR cafes, in Darling Hall and at Signal Towers, or any other MWR established facility. Onto our fitness centers. We've taken gyms 5 and 6, also known as Cyber and Nelson Fitness Centers, and those have been converted to LSAs or logistical support areas. We're using those as standoff to allow for us to do operations for soldiers that may come back from overseas operations or press on to overseas operations, but it gives us a capability here on the post to be able to handle operations as they arise. We currently have no soldiers in those LSAs, but we have those stood up as a contingency option. The remainder of our gyms and indoor fitness facilities, Victory Fitness Center, Gordon Fitness Center, and the indoor pool, we've now restricted strictly to just shower activities from 05 to 09:30. So for the units that are here doing PT on post, and if they live off post and they come on to do PT, they're allowed to shower on our installation at those 3 facilities, and then can go on to duty from there. But we are not conducting PT in the gyms. The last town hall we had restricted just to active duty, and at this point in time, we're not even letting the active duty folks use the gym facilities other than for showering. We're also leaving our outdoor range complex open, and that's been a good facility for us on DFMWR. So I encourage anybody that wants to go out and shoot and have some social distancing, that's a good place to do it. So we'll cover a few things here on AVs, and AVs for us here on the installation is like our Walmart and our gas station Costco all kind of rolled into one. So we have a number of AVs facilities. The main PX is the one most people are familiar with, which is at the mall, if you will. And so that's where the main store is, and there's a Starbucks there, and there's a food court, PenFed, and a bunch of other kiosks and activities. So I'm going to talk a little about what AVs is doing and who they're servicing under which hours they're serving. So currently, AVs is open to all authorized patrons. They have restricted some of their hours to be able to maintain their workforce. So some of the original changes made to hours had a lot more to do with availability of AVs personnel to run those facilities. So we didn't want to run at the margins and have to change hours every day or day to day based on availability of workforce. So we are now, and I think we're in a defendable terrain, if you will. There are a number of AVs options though that have closed for the near term. So some of those are listed here, but I'll cover a few. So at the main PX, the optometry clinic and the opticians, the people that are cutting your glasses, they are currently closed. All the vendor kiosks that are in the middle of the main PX, those are now closed. And then at the hospital, the Crump Landings facility, the majority of the exchange facilities there are closed. That includes the Starbucks, the barber shop, and their exchange. The AVs is also limiting sales items. So for the highly sought after items, toilet paper, paper towels, sanitizers, there's a limit based on that demand signal to 1 to 2 items, depending on the AV store manager's preference and their availability, but there is a limit to how many items you can buy for certain types of items. If you'd like to have up-to-the-minute updates, if you will, about AVs and any of their facilities, they have a great Facebook page, and it gives all their hours and all their services that are listed on a day-to-day basis. So last but not least for the garrison, we're going to talk a little about the commissary. I know this is a hot topic, and this is going to come up through Q&A probably. Command Sergeant Major Sterrett and I, along with members of the CCOE command team, are through that facility on an almost daily basis. We're talking to the retiree population and the active component population to see how things are going. So what I would tell you right now is when we open the facility in the morning up until 1300, that is currently just for active duty military and their dependents. That includes the activated reservists and guard members that are on orders. That includes our foreign military, the folks that are here invited to be here to work in CCOE. They're allowed to be in the PX at that time, or correction, the commissary at that time. And so it's strictly active component or active duty soldiers, sailors, airmen, Marines, and their family members that are authorized during that time. And then at 1300, we transition over to all patrons. So the retirees, the VA benefit card holders, the retiree dependents, anybody can come into the commissary at that point in time and shop until the commissary is closed. We've received a lot of feedback about how we're currently doing our hours, but I would tell you is we're going to leave that in place for several more days just to see what the traffic patterns look like and see what the effect is overall. What I would tell you is that we're still doing 100% ID card checks at the entrance to the commissary. That's had a good effect for us to knock down people bringing in unauthorized family members or friends. And so that has helped our inventory control for the larger installation. We have a courtesy patrol that is out there that is enforcing that ID card check. They're also enforcing our social distancing of 100 patrons total in that facility. So the courtesy patrol is counting folks going in and counting folks coming out. That allows us to have the standoff that we require inside that facility. And overall, the feedback I've gotten from the patrons and from the commissary staff has been overly positive about 100 being a good number to work with. So we're going to hold that for now. So that is the garrison update and the facts as I know them today. And I'm going to be followed by my battle buddy, Colonel John Batson, 15th Signal Brigade Commander.
Hey, thanks, Jim. Hey, so I just want to give a quick update on some of the changes that we've implemented within the training brigade, in the brigade and schools. Unfortunately, we're no longer going to allow our AIT soldiers in the barracks to receive personal visitors. And that's effective through getting through this COVID situation that we're in. We're no longer conducting mass graduation ceremonies. Instead, graduations are conducted at the company level. And this means we're going to have several ceremonies across the brigade footprint simultaneously. So folks that want to watch their soldier graduate, I encourage them to look at their company Facebook pages because we're not going to live stream them off the brigade page. What we will do, to the best of our effort, is consolidate those photos and videos after the fact and get them onto the brigade page. We're strictly enforcing TRADOC regulations with regard to DFAC use. Soldiers are only authorized 15 minutes minimum in the DFAC. They're not authorized to speak to one another. We've implemented staggered seating in the DFACs. We've also increased the number of hand washing stations that are available. Out at DFAC 1 now, as folks see on post, working with the garrison and Miss Crisp from MWR, we've gotten some tents set up, some additional tables, and some additional staggered seating. We've also, we're working with the LRC to increase the number of paper products that are available so that we could just dispose of items rather than have to wash them and reuse them. As I mentioned, we made an earnest effort to get hand washing stations, not just at the DFACs, but we're placing those across the brigade footprint to include outside classroom buildings. And that's going to take us a while to get all the contracts in place and get the hand washing stations positioned. But as Command Sergeant Major Gauls and I walk the footprint, we're seeing the hand washing stations going up and we're seeing soldiers use them. In those areas where we've been able to reduce classroom capacity, we're doing that. We're working both with the Signal School and the Cyber School to reduce the sizes of classes. I think that on the Signal School side, we're getting close to a solution so that we can reduce the class size by up to 50%. On our buses, the buses that transport our soldiers to class, we have reduced capacity on those buses by 50% to enable staggered seating and social distancing on the buses. That does mean that the buses have to make more turns to get the soldiers to and from their classrooms, but that's okay, we'll keep that up. And then pending clarifying guidance, we have temporarily suspended PT. I believe that we will reinstate PT once I've gotten confirmation back from my battalion commanders that we have enforced social distancing within our PT formations, and then we will restrict partner-assisted exercises. And then pending any other questions, sir, I think we're ready to go into the question and answer session.
All right, John.
All right, sir. I'm not sure whether this is a you question or if it's a public health question, but we have someone asking if the veterinary clinic is necessarily mission essential, i.e. why would services at the hospital be curtailed, but the veterinary services seem to be business as usual?
I wouldn't say the veterinary services are business as usual, and if Colonel Blanding has something she wants to jump in on, I'll be certainly happy to take her comments as well. But from my perspective at the garrison level, there are a number of functions that occur through the veterinary clinic, and I'm not necessarily focused on the health and care of individuals' pets. What I am concerned about is we have a canine detachment here on the installation. Those working dog teams still deploy overseas. They still get Secret Service missions. They still do national missions as required, and they support us here on the installation. So there is a veterinary clinic for a reason, and part of that is to support the canine functions that we have here on the installation. The other thing the veterinary clinic does is they have food health inspectors that are out of that office that are inspecting the commissary to make sure that the handling of the meats and the products that are there are done to standard, and to make sure that we're meeting all the health code requirements. So from a garrison footprint perspective, we view the veterinary clinic as a mission essential requirement.
And that segues very nicely into something that we're seeing a lot of people wanting to know: who determines who is mission essential within someone's formation and organization?
To my way of thinking, unless other commanders want to jump in, first of all, there are some rules about at the DoD and the Department of the Army level about what mission essential and mission critical look like. So there are some broad guidelines at the department level. But we also have some guidelines that we follow here locally, and that unit commanders can make a determination to say that certain personnel are mission critical based on the missions that they have here locally. And so ultimately, that's why they have commanders here with command authority to be able to make those decisions. They don't make those decisions in a vacuum. They do that based on an integrated mission set and trying to see what the requirements are. And what's mission critical today may not be mission critical tomorrow, and the things that are not mission critical today may become mission critical in the future. So it's a sliding scale depending on the missions that were handled or handed from higher headquarters, based in consultation with the senior commander and the command sergeant major.
And we'll jump right into the schoolhouse. We've had a lot of people asking both about the situation with social distancing or the inability to social distance within the classroom format, and then the same thing in the barracks situation.
Yeah. So what we've implemented in some of the classes that we can, and I'm not talking just AIT. We've got NCO Academy students. We've got officer students, warrant officer students, and enlisted students. But in some of the classes where we can, we have gone to a distance learning model. For some of the other classes that I think most folks are concerned about, which is those AIT classes on the signal side, I would tell you that working with the signal school, we have got a plan that we have developed. We're continuing to refine it so that we can go to 4-hour shifts. So a morning 4-hour shift that would reduce capacity inside the classroom by 50%, and then an afternoon 4-hour shift. Meanwhile, soldiers that aren't on that 4-hour shift would be conducting a study hall separate and apart from the classrooms that they would normally be in. I hope that helps to answer the question.
Thank you.
Yeah.
What's being done can be done in the meantime.
Right.
Mission dictates otherwise. Sorry, sir. I'm going to catch up with some of these questions here. I wanted to get to the ones that were at the top of the feed. How are families being looked after while they're in quarantine? So if a soldier and his dependents are all on, I shouldn't even, it was in the question, but they're doing their 14 days restriction of movement as they're being monitored. What's being done to make sure that those dependents are also looked after?
Is that for me?
I think we've got so many different families that fall into those categories.
And I would tell you that I think it's dependent upon the individual situation, right? So I've got a soldier right now who was on leave when this started, and the soldier is not even in the state. And so we've got chains of command checking with the soldier just to make sure that she's okay, that her family's okay. I've got soldiers that were TDY when this occurred, and they're in restriction of movement in a barracks room, and that makes it a lot easier, right? So then members of the chain of command can go check on the individual soldier, right? And they may not even be with their family. So it kind of depends on the situation, and I'm encouraging chains of command from the company level up to continue to take care of their soldiers, continue to take care of the soldiers and their families. Check in with them.
We've seen some units saying that the family readiness groups are actually
Right.
checking in, asking if errands need to be run, this kind of thing. But then we've had others say that their FRGs are not as involved. But I would also, and medical intervention doesn't, like checking of temperatures and these kinds of things don't happen unless symptoms are actually presented, correct? I believe that's the case. I'm sorry.
Yes.
Ma'am.
Are you asking
Yes.
that question?
Yes, ma'am. So when would medical personnel become involved with those that are on restriction of movement as
Once
they're
they
being?
become symptomatic.
That's exactly
Yes.
right. Okay. We've had some people ask if there's any chance that the gyms are going to be reopened. No time soon. Any suggestions from the leadership about how to get after the physical readiness piece?
So, you know, I'm an old soldier like some of the folks here on the panel with me. And
Speak for yourself.
I've been in a number of tactical units that did not allow you to use the gyms during PT hours. And so for pretty much the entirety of my career, from 0630 to 08, or whatever the approved PT time was, our formations were not allowed in the gym. We were allowed to run. We were allowed to use the Army for the Army personnel. You know, what is currently PRT. That's a great workout, and that will absolutely keep you fit. So there's nothing in the gym. The gym is a great augmentation to a base fitness plan, but that in and of itself is not going to win the battle for you. You have to be able to do it. And if you were deployed in a tactical environment, until you get into an established long-term FOB, you would have to just do the regular Army PT that you know how to do on a daily basis.
Thank you, sir. Sir, I think we probably need to touch on the graduation piece one more time. We
Yeah.
still have folks asking if they can come physically pick up their children.
No,
Their
no.
soldiers.
AIT soldiers are not authorized to have visitors from off post.
Yes, sir. And-
So, as the orders process gets turned back on, and I didn't address this when I was up there, but when the orders process, it is turned back on, and we're starting to see it, see soldiers flow out. I got 56 soldiers that will be leaving in the next 24 hours. But the priority for those soldiers getting their orders turned back on goes to National Guardsmen, okay? And then through Jim's crew and Department of Human Resources and working with Carlson Wagonlit, we're arranging government transportation, government-funded transportation for those individuals to get back to their homes. I don't want families driving from all over the country, showing up to Fort Gordon to pick up their child, okay? And so I'm not allowing families to go over to the barracks. I'm not allowing families to show up at graduations.
Not allowed them on post.
Essentially, we're not allowing them on post. If they're coming, if they don't have business on post, then I don't need them coming here.
Yes, sir.
That's really what it comes down to.
And to backstop Colonel Batson, we've added a policy at the Visitor Control Center at Gate 1. So that's normally where all the visitors come to for the IT graduations, or to check in and get a day pass to see their kids or family members. And currently the VCC will not cut a visitor pass for anybody here visiting 15th Signal Brigade.
No. We're having a lot of questions about the HPCon status. How is it determined? Who determines the HPCon status on the post? And then there's a follow on about what might happen in
Can
the
I
near
take a
future.
swinger first, Carlene?
Oh, sure.
All right. So, first of all, Colonel Blanding is our senior medical officer here on the installation. So ultimately, the recommendation about whether our installation, and when I say our installation, we're really managing two separate groups. We've got Fort Gordon proper here right outside of Augusta, and we also have the Gillum Enclave, which is just east of Atlanta Airport, over across the state. So we have two separate, geographically separated areas that can be under different HPCons at different times. So what we rely on with Colonel Blanding and her team is to look at the conditions of the surrounding counties, the medical conditions that are out there in the near area, and to make a determination about whether we should go to an elevated level of HPCon. So Fort Gordon went to HPCon Charlie, which is where we're at now, well before some other installations, based on the conditions on the ground here. And then the Army as a whole made a decision recently to move all Army installations to HPCon Charlie. So all Army installations, all 75 camps, hosts, and stations are at least at HPCon Charlie currently. Now, within HPCon Charlie, there is some room for interpretation by the senior commander about which controls that he would like to put in place. There are some things that are you shall do, and there are some things that you shall consider. And so we sit down as a leadership team with Colonel Blanding, with other public health officials, with our law enforcement partners, and ultimately go back to the senior commander and his command team to make a determination or recommendation on where we are going to be and then which controls that we're going to put into place. So right now we're at HPCon Charlie, both for Fort Gordon proper and also for the Gillum Enclave. And we will remain so until such time as the health conditions prevent us from being there, and we have to look at the next elevated HPCon level, which is Delta. We don't believe we're on the cusp of that right now, but then we're also going to follow whatever the Army directives are. So if the Army, as an institution, decides to move us to HPCon Delta, then we will fall in line with the Army guidance and move that stature, that posture.
So it might be a little too early to speculate about what effects would happen if we were moved to that currently.
That's
Because
correct.
we've had a couple of people asking.
We're actively planning against lots of different contingencies. So what does HPCon Delta look like on our installation? What recommendations are we going to make to the commanding general and senior commander about what we're going to do and what that impact is going to be? I can tell you as the garrison commander, my goal is to maintain access to the post for as long as possible for certain key functions. I'd like to maintain access to the post for as long as possible for all of our construction projects. We have a number of things that are going on here on the cyber campus and roadwork projects. As I do an assessment and I look through multiple construction sites, I'm seeing the work is going on is not large clumps of workers getting together and doing things. It's distributed work. So I think the risk there is low, plus those workers are not interacting with service members at the food courts or anywhere else. So we want to continue to maintain the momentum that we have for our construction projects if that's at all possible. And I also recognize we're servicing a large retiree population here in the CSRA. So ultimately, I'm going to try to make sure that we're maintaining access to the post for that retiree population for as long as we can. Because ultimately I see that you as the retirees are coming here to the commissary, you're coming here to DDMAC, the medical center, you're coming to the pharmacies, and for some of the folks that are out there, that's their primary lifeline, and we're going to try to maintain that capability for as many patrons as we can over a period of time, understanding that the number one goal we have here is to preserve the force, and protect the force that we have.
Thank you, sir. We have had quite a few people that are in the contracting community asking too, if they have questions about whether or not they should be working on a project, or who would give them the notice if they weren't supposed to show up to post.
So the contracting officer representative should be the person that they talk to. So we have a number of contracts that are essentially managed by the Corps of Engineers. That's the vast majority of our contracts that we have. That are outside construction, although there's a number of IT firms that are doing work in a number of our facilities. And those individual contracts are managed by CORs, contracting officer representatives, and also the contracting officers who will be able to give better guidance to which contractors can come on and if they can't. An example would be based on the current HPCon levels, we'd be concerned about contractors coming in from central Atlanta to go do work here on the installation. That is beyond the 100-mile radius for us currently, and that is something we would have to have a discussion with the COR. And that if it was important enough, and ultimately a commander wanted to take risk to bring a contractor into their area, that is an exception of policy that they'd have to submit to the commanding general.
Thank you, sir. This one is going to go to the hospital. Some people are asking if I am an instructor in the schoolhouse, or if they do work at the hospital, what are some recommended steps they can take to make sure that they're clean and ready to go into their homes where they have children?
Okay, so I would recommend that you use all of the preventative measures we've listed repeatedly. To go above and beyond would be certain things such as taking off your uniform prior to going into your home, or your clothing prior to going into your actual home, maybe in the garage, or however you choose to do that. But at the end of the day, it's still the hand washing, it's still the sanitizing, it's still making sure that we're employing all of those preventive measures that we've talked about. Additional stuff is, of course, taking off your boots and your clothing in your garage area.
Thank you, ma'am. We also have people wanting to know, are there any changes to the retirement physical appointments?
No, because there's no stop loss for retirement. We're tracking that individuals are still allowed to retire, so we'll continue to meet the needs of that community.
Does the hospital have the ability right now to test for people that believe they might have the coronavirus?
Do we have the ability to test? We have the ability to test. Again, we follow an algorithm to ensure that we are maximizing the resources that we have. And so we usually test for individuals, and we have the capability because there's also what's called LabCorp where we send the testing results to. And so, yes, I'll just leave it at that, yes.
Thank you, ma'am. Sorry, I'm trying to find another one that has a lot of traction. Sir, at this time, those ISD soldiers that are providing the funeral details, they are still mission capable and providing those services?
They are. So I can talk a little bit about funeral details. So first of all, we have an Army level tasking to provide Army funeral support to a number of counties here in the state of Georgia. And so those funerals are for service members and soldiers that are on active duty that pass away while they're in uniform. It is for retirees that pass away, and it's also for veterans who may have served anywhere from 2 to however many years that didn't retire, but that are authorized veterans funerals. There are some different ways that we do funerals. So the smallest funeral detail that we can provide is 2 personnel, which we do for a certain segment of population, all the way up to 7 personnel for active, currently serving active folks and retirees. What I would tell you is it's at our discretion how we do that, and so currently I've scaled back all funeral details to 2 personnel only. We also have the ability to cover all those funerals with outside the radius of 100 miles for a few select counties. We also have a partnership with the Georgia National Guard where they are providing coverage for us in the Atlanta area, which we're grateful for. And so we're going to continue to provide funeral services as long as the Army directs us to do so. That's an Army level tasking. That's not something that the senior commander can relieve us of at this time. And so as long as the Army is requiring us to provide funeral support, we will continue to do so.
Thank you, sir. Colonel Batson, we've had a couple of parents too ask about their soldiers who are graduating but have assignments overseas. What is the status of those soldiers?
So right now, the soldiers that had projections to go overseas are on hold. When they graduate, they go into a hold status. And as the Department of the Army and the Department of Defense lift restrictions on soldiers being able to go overseas, that process will turn back on. Some of those soldiers, though, will be reassigned within the continental United States or within Hawaii or Alaska. So it's different for different soldiers, and but we're not going to send soldiers right now to Italy, to Europe, to Japan, overseas.
Thank you, sir.
So I can fill some space here
Thank
for
you,
y'all
sir.
on some of the tenants. So Colonel Batson and I worked out with DFAC 1 from a social distancing perspective. And so we're still trying to come up with some additional tent areas, either from units or from our own MWR. But we've expended a large number of tents in support of DDMAC hospitals so they can do their outside screening. And so that's the number 1 priority for any tentage right now, and that's where that's gone. We had the ability, and we did provide some tents over to Dining Facility 1. Ultimately, I would like to put more tents up outside of DFAC 1. And I'd also like to put some tents up in some of the other AIT dining facilities specifically. And really the intent of that is to allow soldiers to have better social distancing and to spread out over a larger geographical area to go ahead and eat. So that's, I would imagine you're going to see over time more tent facilities going up outside the dining facilities. Again, that's just to give us more eating space for our service members as time goes on. We have 1 canopy that's up now in front of the commissary. Ultimately, I'd like to put some more out there because I recognize we have a number of retirees that stack up there about an hour before they're authorized to come in, whether it's at 1300 or when we first started doing this, they'd come in the morning, you'd have this enormous line outside the commissary, and I recognize that it's not great to be standing out there in the rain or the heat or whatever else. So as other tents become available, and I work our way through the priorities for Dwight D. Eisenhower Medical Center and for our training population, we want to move some of those tent capabilities or canopies in front of the commissary, so we're keeping our retiree population out of the weather elements to the best that we can.
Thank you. Ma'am, someone wants to know if a service member is symptomatic, would they be treated for COVID-19 here, or would they have to seek care off of post?
If they're a soldier, they're here at DDMAC.
Thank you, ma'am. Similar thing, I think this is a barracks housing question. What is the installation doing if a soldier needs to be isolated in his residence, but he happens to have high risk dependents?
So I think there's a couple different ways to get after that. So first of all, the way I would do it, along with most of the commanders, I believe, is we would ask for a medical disposition of that case. I would hope that any of us as commanders are not making a medical decision without medical input. So anything that we do, at least in the garrison, that affects our service members, I'm asking Colonel Miklos, I'm asking a number of the other public health folks, the senior nurses, the doctors. We have a number of folks that are tied into us here through the EOC, and we get hourly questions about individual situations about how are we going to do this. And again, I'm not making a decision reference the life, health, and safety of the service member without a medical input from Colonel Blanding and her team. So we lay out the facts as we know them. Sometimes they're not presented fully to us at the get-go, but the facts that we have at the time from the service member, we take that information, we sit down, we do a huddle with our medical personnel, and we go, okay, here's what the case has been presented to us. We have a high-risk family member, we have this going on, this is the service member, where the service member is coming from, and then what's the risk profile? Was this person just 101 miles outside in a rural area, or was this person coming back from New York City? There's a big difference from risk profile that goes along with that. And we want to take a look and say, okay, and then what are the risk profiles of the service members' family members if they're doing a restriction of movement at the home? So currently, we have not, to my knowledge, at least in the garrison, had any cases where we've had to move people out of their residence and put them into barracks. Could there be a situation that would do that? I could see that certainly is happening. Understanding that we are at Fort Gordon totally in a barracks shortage. We have a number of barracks facilities that are offline right now because of black mold and other things, and so we're not looking to put service members or anybody else back into those barracks, even on a temporary basis, because of the health concerns that we have long term. So because of that, we're managing this down to the eaches, the name tape level of who's going to go into a restriction of movement barracks and who is not. And so we'll continue to take those on a case-by-case basis. I would ask any of the service members that have concerns about that they work that through their chain of command. We meet at the brigade commander level daily, at least amongst the key folks that are making decisions, and certainly among the medical personnel. And as cases come to us, we sit down with the hospital staff and make a determination of what is in the best interest of the service member and their family. And in some cases, it may be to remain in the residence, and in some cases, it may not. But we'll take those on a case-by-case basis, and I won't litigate your issue, at least on the Facebook town hall. But there's a wide variety of things that could happen based on the medical advice that we receive in that particular case. Colonel Blanding, did I cover that accurately from your perspective?
Yes, you did. And I just want to add one thing. We have medical expertise at Eisenhower, and we rely on our medical expertise to provide and inform decisions making along with all the command groups. So I think it's important to understand that we're all in collaboration. We do not do things individually here, especially during a time of crisis. This is a discussion across the breadth and depth of all of the resources and all of the things that we're doing on the installation. And Eisenhower is very much embedded in ensuring that we work together as a team when it comes to the health and wealth of our soldiers and the beneficiary population that we serve. And so I think everyone should feel confident that as we're going through this crisis, that there's deliberate planning, that there are deliberate measures in place to ensure the safety and the well-being of not just the staff at DDMAC, but the entire population of Fort Gordon.
And to that, ma'am, we had somebody ask that, and I've seen this in the news too. So if you go and you think that you're symptom positive and you're denied a test, and I know that there's criteria for being tested, any recommendations on what that person's next step? If they didn't meet the medical provider's criteria for testing? Is there some kind of standard procedure out there?
The standard procedure is the diagnosis, if you are COVID-19, is a medical provider. And that is really, self-diagnosis is not appropriate at this level. If you have gone in to see your primary care and they've gone through the algorithm and determined that you're not COVID-19, then we have to, again, be careful in terms of ensuring that we are maintaining our resources. Because as we go forward in this crisis, we're doing deliberate planning. And so just because Blanding feels that, I should be tested, unless a medical provider, a clinician says, Blanding, you need to be tested because you exhibit these symptoms. And Colonel Mikolos has really talked about laying out the algorithm, pneumonia, those critical things. Then it is not necessary for you to be tested. And your clinician, your medical provider has made that determination. And you should feel secure in that determination.
Thank you, ma'am. Colonel Batson, this is a little bit in the weeds, but
Okay.
If a person has a soldier that has graduated at Fort Jackson and they're due to come here,
Yeah.
Approximately how much time is it currently taking for a soldier to move and from basic to the AITs?
So I will tell you, in the past several days, over a week, we have not received any soldiers coming into AIT. And what TRADOC and what the Center for Initial Military Training is doing is they're not going to send us soldiers until they have a method of sending them to us in a sanitized transportation method, okay? And we receive soldiers not just from Fort Jackson, but we receive soldiers from other basic training installations. I think that TRADOC is gonna limit that so that we only receive from Fort Jackson. It's a short drive, and they'll be able to get the contracted buses in place that are sanitized and clean. Soldiers will get screened before they get on that bus, and then when they arrive here at Fort Gordon, they'll get screened by the medics that I have organic to the brigade before they're placed into the barracks or into class. When that pipeline's gonna get turned back on again, I don't know. I think it'll happen sooner rather than later, but I don't have a definitive date on when all the contracts will be in place to allow soldiers to transit from Fort Jackson to Fort Gordon.
Thank you, sir.
Mm-hmm.
Colonel Blanding, people are asking about surgeries at the hospital. Right now, what is the status if you had like an elective or outpatient surgery? Are you still being allowed to keep your appointment?
So what we're doing to ensure that we prepare is that individuals are being contacted by their primary care manager to, if it's not life or death, of course, is to push that off, okay, to either postpone it or cancel it for the time being until further notice. And so we have that on our website, on our Facebook, and on our website. We have that information posted, and patients are being contacted via their primary care managers when it comes to their personal appointments. So when you call, you'll speak to your primary care manager that will provide you the status of whatever appointments you may have.
Thank you, ma'am. Ma'am, I think this one might be for you. How does the algorithm determine testing for asymptomatic patients who are exposed and could be spreading it, or for the reported change in symptoms? It seems to me that an algorithm cannot diagnose a patient, and if they could, doctors would be obsolete.
So that's correct, but understand this is also a fluid situation, and those algorithms have changed even, as recently as a week or two ago. So we have to balance what resources we have on hand with the clinical picture of the patient. So right now, there is an algorithm that is subject to change. And originally that started out was travel to a level 3 country, and as that clinical picture changed, it became more to had you been exposed to a place where there's a known outgoing outbreak. Well, now we're finding that as this outbreak spreads, it's going to be, we assume, ubiquitous. However, we don't have the number of tests to be able to test a ubiquitous entity. Now, those testing capabilities are being ramped up, but this situation is fluid and evolving. If we're able to get in enough tests to either rule out or rule in, because those are really the two different pathways, we will certainly open up testing widespread as possible. But for now, and again, this is subject to change, we've got to be concerned about conserving those resources for our most ill and our most sick patients to be able to treat and diagnose them accurately.
Thank you, ma'am. We've had a couple of people asking about confirmed cases on the post. I believe there's only one confirmed case on the post right now, Colonel Blanding. Is that accurate as of today?
As of today, we have one confirmed case on the installation, yes.
And that is the retiree. Thank you, ma'am. We just wanted to confirm it because we were seeing it show up quite a bit here in the feed.
And I think we've got time for one or two more questions.
All right. Are there any, sir, are there any plans being looked at to potentially change the hours to allot for the retirees to come in during a special window at the commissary?
So I would tell you is that, obviously I'm seeing what's happening in town as well, and I think there's a number of grocery stores that have an hour set aside maybe twice a week for people in a certain age category. That's certainly something that I'm interested in taking a look at as a possibility as we go forward. But for the next several days, potentially up to a week, want to make sure is that we have the hours that we've set in place burned in, that we go with that, because what I'm finding from the retiree population is a lot of them are not on social media, and so as we make changes to the commissary hours, they're finding out about it when they drive to post, get to the commissary and figure out that they can't get access at the time that they thought they could. And anytime we make a change to the commissary hours, we're finding that has an effect on our retiree population overall. And so it's something certainly we're considering. I'm in daily consultation with the DECA director of the commissary lead, but at the end of the day, we're going to try to let what we currently have in place go for another week or so, and then we will relook those hours to give potentially some of our more vulnerable populations some set aside times. But understand that we will, regardless of what our future plans are, we are still going to have hours that are strictly for active component and for their dependents, regardless of how we move the hours around as we go forward. I think that takes us to our final bit of time. Command Sergeant Major, I believe it's over to you.
So I just, for closing comments, I do want to thank everyone that took the time to be here today and join us, and definitely was active in the dialogue. We know there's a lot of anxiety and a lot of uncertainty out there. To include, there are a lot of questions. That's the reason why we hold these town halls, to inform, to educate, and to keep a consistent communication with all service members, their families, and the community. But make no mistake that our number one priority is to protect you and your family. Please continue to follow CDC guidelines, have trust and confidence in the leadership, leverage your leadership to answer all questions and assist you in anything that you may need. And I want you to remember the acronym TEAM, meaning together, everyone achieves more. We are one team, this is one fight, shoulder to shoulder. We will get through this and we will win this fight. Thank you for what you do. Continue to stay safe, continue to stay resilient, forge and protect power.
So thank you for your participation. Thank you for the questions. Those that we were not able to answer in the time allotted today, we'll continue to answer online. So I'll hit the team aspect. So what you saw in the town hall today is a bunch of people wearing Army uniforms, but I will tell you, we are very much a joint post, and our partners in the Navy, the Air Force, the Marine Corps, the Coast Guard, our NSA employees are all part of that team. And all of the leadership of those organizations is involved in every decision that I ultimately make for the health and well-being of this post. We will keep you informed. Again, follow me on Twitter at CG_CyberForge. for another stream of information, and keep in touch with your chain of command, and we will do our best to keep you informed. Thank you very much.